Brown, Physical. Hey everyone, it's Dr. Eric Brown, physical therapist here at Movement Restoration in Sioux Falls. Hey, I wanted to spend the next few moments discussing a few things I got in the mail today that are pretty neat that I wanted to share with you. These are patient education models for total joint replacements. These were sent to me from Stryker. Stryker is a company that develops and makes medical equipment and hardware, and in this case, total joint replacement parts. I use these tools to educate patients what is going inside their bodies either before or after surgery. So great resource for us, and I figured I'd share it with you. As you know, there are many joint replacements done each year. There are 600,000 knee replacements done each year. There are 450,000 hip replacements done each year, and 53,000 shoulder replacements done each year, according to the American Academy of Orthopedic Surgeons. So there are a lot of new joints going in people to help them feel better, move better. It's a great resource for the right person at the right time. But let's take a few moments to discuss each of these because I think it will provide a little clarity. First is being a total knee replacement. There are 4 parts. You have your femoral component, your tibial component, your plastic spacer, and your patellar component. So patella is just your kneecap. So on the back side of your patella, you'll have a plastic piece as well. So femoral component of the femur, the top thigh bone here, will accept a metal component after it's been shaped. Same thing for the tibia. The tibia gets leveled off and provides a great surface for the attachment of the tibial metal component. And again, along with the metal component, you have a plastic spacer, sometimes polyethylene. All that provides great joint mobility, allows for better flexion and extension of the knee, and after typically 8 to 12 weeks of rehab, people are moving a lot better. So I'll put that one back here. And this is your quad tendon, this is your patellar tendon, and underneath of this, again, is your patella. And that, again, is going to help you slide and glide as you move your leg back and forth. Second, we have a total hip replacement. And again, there are 4 parts. It's a ball and socket joint. So first, we have our femoral component. So the top of the femur, you'll have this, and they'll ream out a space for this to be accepted. That'll fit in there like that. You'll also have a new head. This spherical head will then fit inside the acetabulum, and the acetabulum is the dome shape of the hip. After that gets reamed out, this accepts a new socket. First metal, then plastic, then that gets reattached. And again, these are just the components. This is not how the surgery is done. It's a lot more complex than that. If you want to watch how that's done, go find them on YouTube. If you have a sensitive stomach, probably don't watch them, but these are just the components that go inside. So lastly, we have a total shoulder replacement, very similar to a total hip in that it's a ball and socket joint. Just like the femur, we have our humerus that will accept the humeral component. You'll have a metal head, and then you'll have plastic liner of the scapula and the glenohumeral joint. And again, this takes 8 to 12 weeks, sometimes 16 weeks to recover. Same thing for total hip. There are going to be some restrictions on your movement after a total hip replacement that are present with the total knee. That's going to vary on what your orthopedist does and the approach that they take, either anterior or posterior. And you'll be working with your orthopedic team and physical therapist before or after surgery to let you know what you should and should not be doing. Same thing for the total shoulder replacement. There's some restrictions that apply as well. In my experience, total shoulder replacements take a little bit longer, sometimes 12 to 16 weeks, but all of them with the right rehabilitation do just fine. So to wrap it all up, for the right person, it's the right solution at the right time. But if you're interested in avoiding or even delaying a potential surgery and you haven't tried physical therapy, I'd encourage you to contact me, leave me a message, leave a comment below, message me privately through Facebook Messenger, give me a call. I'd love to speak with you so you can learn more about how I can help you through that journey. Sometimes people can avoid or delay their surgery. Sometimes it's the route that needs to be taken. But regardless, give me a call. I'd love to talk with you. Until next time, keep moving, South Dakota.